Ask Your Pharmacist is brought to you by Dragnet, your number one online pharmacy, and the Pharmaceutical Society of Ghana, and proudly sponsored by Lita Pharmaceuticals, quality healthcare. With support from E14, your best vitamin C plus zinc supplement from Samu's Pharma.
Hello, everyone. You are welcome to another exciting week of Ask Your Pharmacist. It's never too early or too late to start living right or being right. And I hope that by the end of today's discussion, you will be a step one, even an inch closer to living right. My name is Peggy Samuel, and you can find me on Instagram at FieryPeg. If you missed any of our episodes, go on YouTube right now at My Pharmacist TV. Like, share, comment, and make sure you subscribe. Remember, this show, Ask Your Pharmacist, is proudly brought to you by Dragnet. Dragnet is your number one online pharmacy. Download it on the Google Play Store or the App Store. Order all your medications, speak to a pharmacist, schedule a refill, and wherever you are, wish your konongo no rungo, they will deliver to you. Dragnet is your number one online pharmacy. The show is also brought to you by the Pharmaceutical Society of Ghana. Amicus Humani Generis pharmacists are indeed friends of the human race. This is also brought to you by Letta Pharmaceuticals with Lettamen. Lettamen is a multivitamin mineral supplement for total strength and vitality, promotes mental performance, and boosts the immune system. Folaron Zinc is a folic acid, iron, and zinc supplement that effectively reduces the risk of iron deficiency, supports immunity, and promotes health and wellness. Letamox is a single-dose dewormer for treating intestinal worm infections, helps to increase nutritional uptake, and basically gets you right. So Letamin, Folaron Zinc, and Letamox are all available in any pharmacy near you. For bulk purchases, contact Letta Pharmaceuticals on 030-222-4613. Letta Pharmaceuticals Quality Healthcare. This is also brought to you by Bell Beverages. Bell Beverages, refreshing the nation. And also brought to you by Tema Christian Eye Center. Tema Christian Eye Center remains the best eye care facility with advanced and ultra-modern facility with skilled and experienced doctors with exceptional customer service. Into so when you know your practitioner new and ampo and set your crown away here. And ma will cast go to Tema Community 1. They are adjacent the St. Paul Methodist Church, or please call them on 030-321-1999. This show is also supported by the Lady Pharmacist Association of Ghana, LEPAC, and the Young Pharmacist Group, YPG, also supported by C14, the best vitamin C plus zinc supplement from Samu's Pharma. For bulk purchases, contact Samu's Pharma on 0501-646494. We are taking a quick break. We will come back, discuss topic, guest pharmacists, and our location. Don't go anywhere. We'll be right back.
When on campus and not well, I worry no more. Thanks to Dragnet. With the Dragnet app, I can chat with a pharmacist anytime for my medications, and they are delivered to me right here on campus.
I am a trader. If I need drugs, I cannot leave my goods and visit the pharmacy. All I need to do is click on the call feature on the Dragnet app and I speak with the pharmacist. The drugs are delivered to me right here. Dragnet, ahotoswo papa.
As a businessman, moving around to search for my medication could be very frustrating. But now, with the Dragnet app, I'm able to upload all my prescriptions and have them delivered to me wherever I am. The Dragnet app also allows me to order refills for my mother to treat her chronic illness. Dragnet delivers all the medications to her on time. It's so reliable and convenient. Download the Dragnet app from the Google Play Store or App Store. Dragnet, your number one online pharmacy.
Welcome back. You are watching Ask Your Pharmacist, your favorite health show. Today we are coming to you from the University of Ghana, Legon, here in the Greater Accra region of Ghana. And our topic for discussion is sexually transmitted infection. And we are focusing much on HIV and AIDS. Today, we are also doing this with our special guest pharmacist. On my further left, I have Pharm Stella Cranting Asante. She's the CEO of Bridgeview Pharmacy at Tantra Hill Runabout. And on my immediate left, I have Dr. Richmond Ama. He is the chairperson for the Young Pharmacists Group of the Pharmaceutical Society of Ghana and also a strategic accounts manager for Viatrix. How you doing, lady and gent?
Doing great. How are you?
I'm doing very well. So I would like to go straight at it, and I'll start with you from Stella. Today we are discussing STIs. What are STIs?
Okay, so STI, which has the full name as sexually transmitted infections. So they are infections that are passed on from one person to another, and it usually happens during unprotected vaginal, anal, or oral sex.
Okay.
They're really very common, and the thing is that most people who have doesn't even have symptoms. There are different types of organisms that can cause it. Normally, you have the bacteria causing, we have the parasites causing, and also virus causing it.
Okay, how common is it? Let's talk about the common types of STIs, something we would find on campus.
Well, STIs are very common, and the most common ones that most people have heard or know is gonorrhea. We have chlamydia, we have syphilis, we have the HPV, which is the human papilloma virus, and then we have even warts, genital warts, we have the genital herpes, and we have the main one which we'll be discussing today, that is HIV or AIDS. Okay,
so from Dr. Richmond, let's talk about HIV and AIDS and the mode of transmissions.
Thank you very much once again, Peggy. Talking about the mode of transmission, my sister made mention of typical example. Primarily and then predominantly, most people get the HIV or AIDS through sexual intercourse with an infected person, especially when you have sexual intercourse without the use of condom, and then you just go in and then have it. Another example is the sharing of needles. I believe that these days many people do not do that, but then when an infected person, you share a needle with such an individual, you can get it. She made mention of anal sex as well. It is also one of the mode of transmission.
Okay.
There is also another one using blades that are used by infected individuals. You can also get it. And one sad mode of transmission is the one from mother to child. Yes, an innocent child getting the virus because the mother is HIV positive, and so there can be that form of transmission from mother to child infection.
Okay, so I want us to really hit right on the nail with the HIV/AIDS. I know back in the 2000s, there used to be so many campaigns on HIV. We don't hear them now. So the Indomie generation or the Gen Zs might not probably know what HIV/AIDS is. What is it?
Okay, so I want to make a distinction here. HIV, we hear HIV, we hear AIDS. So the distinction is the HIV itself is the virus. So the H is the human, the I is the immunodeficiency. So like there's deficiency in your immunity, and then the V is the virus.
Wow.
So when you get the infection is you are infected with the virus.
That's the first stage.
That is the HIV.
Okay.
So I have HIV, It means you have the virus in your system. And this virus can stay in your system for 10 years without even you knowing that you have it until you test it. This virus, as in your system, will be affecting your immune system. That is especially the CD4 cells. And when it gets to a stage where now your system cannot fight common infections, then your body now becomes diseased. So that's where you now have the AIDS. So the AIDS is now the acquired immune deficiency syndrome. So the syndrome is now the signs and symptoms which are now coming, and then now you are having diarrhea is not going, you are having frequent infections is not going, you are having vaginal trash. Now you have what? In fact, any person organism that is going, you will catch it and say, "Come and infect me." Because
So
my
can
system is so
you just
weak.
be like on the HIV? Can you just have HIV and not AIDS?
Yes.
Okay.
Yes.
But you cannot have AIDS and not HIV.
Exactly.
Good. All right.
Exactly.
So how often should we get tested then?
I think annually wouldn't be bad.
Annually,
If
okay.
you are sexually active, then maybe every 6 months. Rich, why are you looking at me like that?
Alrighty, let's take a quick breather. We'll come back, talk about complications, treatment, and prevention. Don't go anywhere. We'll be right back.
Yamamu Aqua Badeba Tema Christian Eye Center eye ini yaresabia Tema Christian Eye ini yaresabia yehwe ini yario bia efree inkolemu ekosi impenimfo so se efa nia ewose ma withdraw anase ne be operation anase se uhia space impo your dispensary fully functioning dispensary edro bia ehia wo se ewose ye de ma na udigu weni so mane kon ubenye bi ye be ma wo beto ne ehia se eye operation bia no ahanso ye ma se etire so kana se laser na uhia eno nso ye yebu Tema Christian Eye Center ha ye ejuma fiti ejuada kopin memnenda aye Monday to Saturday ye wo Tema Committee 1 opposite Golden Chopstick Restaurant anase utumi bisase St. Paul's Methodist asori no
Tema Christian Eye Center, changing lives through proper eye care.
Welcome back. You are watching Ask Your Pharmacist. Today we are coming to you from the University of Ghana, Legon, and we are discussing sexually transmitted infections, and we are focusing much on HIV and AIDS. We are doing this with Pharmstella Kranting Asante and Dr. Richmond Amma. So very briefly, I would love for us to talk about complications. Pharmstella, who would love to take that up?
Okay. Complications of HIV is very severe, and most often than not, these individuals die of the condition because of the complication that's set in. A typical example is pneumocystic pneumonia or pneumonia, where most of the individuals, it is a form of a fungal infection that usually attacks HIV, or let me say AIDS patients, and usually kills them. Another thing is tuberculosis, and then they also, if they are females, they also get recurrent vaginal thrush or candidiasis. You would treat, it doesn't go because the body is already compromised.
And if I understand very well, that means that HIV is nankasanka enku, you know, but is the immunity when it's low, all the other diseases that comes in. That's wow.
Exactly.
Pharmstella, let's talk about prevention because I'm dying to hear it.
We're on campus, so there are other ways you can prevent. But here, in fact, I will scale down to we making sure that we protect ourselves. That is where we come to the ABC. So the ABC way of protecting ourselves or preventing ourselves from the virus getting into our system is that the A is that we should try as much as possible to live a healthy lifestyle. We should abstain from sex. Then the B is that we have to be very careful. The C is using the condom, which is another one major means. Sometimes temptation will come. If you can't stand it, then you have to go is safe. Here, you have to use your condom.
So the B is to be faithful. Or
faithful.
Okay.
You have to be faithful. You have to live a healthy lifestyle. If you want to keep a partner, try and keep one sexual partner. So the main preventive thing I can talk about here is abstinence, be faithful, use condom, and then live a healthy lifestyle.
Talking about condom, can you show us how or the best approach to using condoms?
I'll leave it with them.
Okay, Dr. Richmond.
All right, so I think we have one here. I will show. Okay, so let us see how best we can. Okay. So this is a condom, right?
Can you see it? Okay,
Yes. And so you can see the edges, okay? You can see the various edges. So you usually tear it from the rough edge, okay? So you tear it like this.
good. You bet me yes,
I watched a movie where people used to use their mouth or their teeth to tear the condom. So you just tear it like this.
Wait, we can't use our mouth?
It's
not the best?
necessary
Okay.
because the rough edges
Mhm.
has been made so that you
Okay.
can just tear it from
Okay.
that angle. So you don't try to tear it from the smooth angle. So you just remove it. And then, so this is how it looks like. But then before you use the condom, you should be erect, okay? You should have an erection before you can put on the condom. When the penis is flaccid, you cannot wear a condom. So the penis must be very erect. Let me say it is hard. That is what the guys usually say, or the men. So it is hard. So usually put it on the penis like that. But then usually the tip of the condom, you must allow air to be at the tip of the condom. And then you just rub it on the penis. My finger is very small. I would have used my finger. So you just rub it on like that.
Ah.
So you rub it on, but then you need to leave this air, the air at the tip of it, so that you rub it, and then that is when you can begin to use it. It is very, very important. You need to know how to use it. If you cannot abstain, if you cannot be faithful. But then I will advise you, because you are students, that let us practice the A first, okay? When it gets to the stages where we are unable, that is where you would have to be faithful to one part, even before you go to the usage of the condom. So you leave the air to be at the tip like that, and then you rub it on the shaft to the point that it's now you fully wear, like you are wearing your socks. Okay, that is when you begin to use it. It is very, very important that afterwards, even this is latex, it is rubber, so anything can happen to it, just like our normal ties,
Punctures
under
and stuff.
our vehicles. Yeah,
Mhm.
you can get punctures and other things. So it is not necessary to be very much aggressive. And then you should also, there are various types of condoms as well. We have the various sizes, and then you need to get a condom which is equivalent to the size of your penis, so that you don't get an extra large condom where before you realize the condom, as in it gets off and it gets missing in the vagina of the woman. Yeah, it happens a lot. In the pharmacies, we had one patient, a lady who came that a condom got stuck in her vagina. Yeah, because it was so large that the guy was unable to find it before they realized it had happened.
So how do you know a condom will fit you?
Every guy knows his size.
Ah.
And so I will advise that when you go to the pharmacy, try and then buy the normal size. But we have others, extra large, extra large.
Okay.
Depending on where you are coming from.
Oh, there are some like that?
Yes, I want to add up. Before he did the opening, were some cautions that needs to be taken into consideration. One, anytime you buy a condom, check your expiration. Just check the pack and see if it has expired or it hasn't expired. And then you check if there is any damage on the pack. Mostly it's supposed to be air-filled, so it shouldn't be really tight. The pack shouldn't be really tight. And the men, you shouldn't also put condoms in your wallet and leave it at it, but the heat will destroy it. And then don't forget to dispose of it appropriately.
It is not reusable.
Yes.
It is not reusable.
Yes.
Now let's talk about treatment and management. So I'll start with you, Doc, on the treatment of HIV and AIDS.
I don't want to be the devil's advocate, but unfortunately, HIV is not treatable. If you're not careful and then you engage in unprotected sex, that is it. You stay with it for life. But then the good thing here, for those who have HIV, is that the government has made it possible for these HIV patients to access the medications. So what the medication does is that it manages you so that the disease does not progress into the A state.
Okay.
So you forever stay HIV until you die. And then they also manage some of the opportunistic microorganisms that come to attack you.
Have anything to add? Okay.
But one thing I'll say is that people should learn to keep people's secrets. When somebody confides in you and tells you about their status, try and keep it a secret. When secrets are broken, it breaks trust and it affects the emotional health of the individual. So that is the little.
Okay, wow. This has been very didactic, and I hope that everybody has, penned down a thing or two. And if you're watching me and you're HIV or AIDS positive, hey, like you heard from the expert, it's not a death sentence. You can go ahead and live a normal life and might even end up being healthier than somebody with, some other conditions. So just, be happy, just be hopeful, and everything is going to be okay. Alrighty, so we would open it up to our audience. If there are any questions for our experts, please would like to take it.
My name is Daniela Quest. Okay. Quest. I wanted to ask concerning the tracing. What if someone is HIV positive and goes to a restaurant and eats? Can someone who use the same plate get infected or not?
So can you get infection from utensils?
No, you cannot. Just like you have a family member or your family members who are positive, you can even eat from the same plate or the same bowl, and you will not get the infection.
So last question, the gentleman over there, and that will be it.
My name is Edward Osubuating. I would like to ask how frequently you can take the post-exposure prophylaxis, and also if it's safe to suck the breast of your sexual partner.
Okay, so I think I'll pick the last question. I'll start from the last question first. Every healthy woman who is not breastfeeding shouldn't have fluid in the breast. If you have a discharge of fluid in a breast, it means there is something wrong. Maybe your prolactin levels are with that needs to be tackled. In natural sense, if you are sucking the breast of your partner, there shouldn't be any fluid that will come out. So you'll be safe to suck unless there's fluid coming out. And then when it comes to the PR, the prophylaxis one, first of all, when you are an HIV patient and you live with an HIV positive patient and you have a partner who is HIV negative, sometimes the negative partner is put on daily preventive medication. That option is there, aside all the other preventive measures. Also, when maybe you are raped, unfortunately, and maybe they do the test because the first few months, it wouldn't have, the viral load would have gone high for it to be seen. So at that stage, they can also give you a prophylactic medication in that in case the virus got into the system, it can be tackled.
Is that a start dose or you have to take that for the rest or maybe a certain duration?
A duration and then you stop.
Okie dokie. So I hope we all learned a lot about HIV and AIDS today. Okay, so if you sure did remember anything, I would love to test that. Okay, and we have these amazing gift packs from Letta Pharmaceuticals. Let's give it up for Letta Pharmaceuticals. Thank you. Yes, I love the sound of that. And for our lucky winners today, I'm going to ask you 3 simple questions of all the discussions we've had. And if you get it right, you go home with any of these gift packs. And I know you love what's in there. So my first question is, give me the difference between HIV and AIDS. Ooh, the gentleman over there with the long pen and book. Yes.
HIV is the virus, and then the AIDS is the disease itself. So when the HIV enters your body as a virus, it fights against your immune system. And when it destroys it destroys your immune system, then the AIDS take over.
Oh, give it up for him. I think he did exceptionally well. My second question is, how do we prevent HIV and AIDS?
I am Shafatu. There are 3 ways of preventing HIV/AIDS. One is A. A is abstinence, total abstinence from sex. And B is being careful. You should be faithful to your partner. And the C is using of condoms.
Okay. So. Ooh, I love the sound of that. And my last question okay, is illustrate with a diagram how to use a condom.
Okay, my name is Jemima Isaku, and before you use the condom, first of all, you check the expiry date.
Good.
Yes. And then you tear it from the tip, the side.
Louder, please. Louder.
Where the rough edge is, so that you can easily tear it. So this way. And then you take it out. Okay, so there should be an air space here. And then you hold it and then...
Louder, the mic should go to.
Okay, you hold it and then you roll it down along the shaft to the end of the penis. Yes. Okay, so you roll it. Yeah, I think that's so.
Did she get it? Yeah. Wow, let's give it up for our pro. Yes. I think she did exceptionally well. So if I could have all my lucky winners walk up to the stage, I have these amazing stuff from Letta Pharmaceuticals for you. And I hope you enjoy every bit of it. Thank you so much. This is for you. This is for you. Let's give it up for them. And a big one for Letta Pharmaceuticals for these amazing gift bags. Thank you. Dose for Healthy Living is up next. We'll be right back.
Today on Dose for Healthy Living, report adverse drug events. Immediately inform your pharmacist if you have a strange or unexpected reactions to your medications and seek care if needed.
So this is where we draw today's curtains on Ask Your Pharmacist. Today we discussed HIV/AIDS, and like our expert did say, if you have it, you have 99% chance to live a healthy life. So do not worry, everything is going to be okay. Remember that this show, Ask Your Pharmacist, was brought to you by Dragnet. Dragnet is your #1 online pharmacy. This show was also brought to you by the Pharmaceutical Society of Ghana. Amicus Humani Generis pharmacists are indeed friends of the human race. This is also brought to you by Letta Pharmaceuticals with Letamin. Letamin is a multivitamin mineral supplement for total strength and vitality, promotes mental performance, and boosts the immune system. Folaron Zinc is a folic acid and zinc supplement that effectively reduces the risk of iron deficiency, supports immunity, and promotes health and wellness. Letamox you can take it, and it's good for your family, and it's for treating intestinal worm infections, and it helps to increase nutritional uptake. Letamox, Folaron Zinc, and Letamin are all available in any pharmacy near you. For bulk purchases, please contact Letta Pharmaceuticals on 030-222-4613. Letta Pharmaceuticals, quality healthcare. The show was also brought to you by Bell Beverages. Bell Beverages, refreshing the nation, and also brought to you by Tema Christian Eye Center. Tema Christian Eye Center is the best and advanced ultramodern eye care facility with skilled and experienced doctors with exceptional customer service. Locate Tema Christian Eye Center at Tema Community 1, adjacent the St. Paul Methodist Church, or please call them on 030-3211-999. This show was also supported by the Lady Pharmacist Association of Ghana, LEPAC, and the Young Pharmacist Group, YPG, and also supported by VitC Forts. It's a vitamin C plus zinc supplement. It's sugar-free. It's good for everybody. And for bulk purchases, contact Samus Pharma on 0501-646494. Like I always say, whatever that goes in you is merely irreversible. More to the reason you always have to ask your pharmacist before you swallow that pill. My name is Peggy Soundone. You can find me on Instagram at Fiery Peggy. If you missed any of our episodes, you since your nyama baby, no problem. Go on YouTube at My Pharmacist TV. Like, share, comment, and make sure you subscribe. I'll be coming your way same time next week. Until then, be safe, be happy, be kind. Bye-bye for now.
Pharmacist was brought to you by Dragnet, your #1 online pharmacy, and the Pharmaceutical Society of Ghana, and proudly sponsored by Lita Pharmaceuticals, quality healthcare, with support from Vit C Fort, your best vitamin C plus zinc supplement from Samus Pharma.